Okay, everyone, I think we will get started. So good afternoon and good evening. My name is Sarah DeFeo, and I'm the Vice President of Scientific Affairs and Programs here at Ovarian Cancer Research Fund Alliance. And I want to thank you all for joining us today as we kick off our webinar series for 2017. Tonight we'll be learning all about ovarian cancer advocacy in 2017 with Chad Ramsey. And as we all know, it's a big year in Washington, D.C., so there's a lot to talk about, for sure. OCRFA's webinar series has been supported by Genentech, so a big thank you to our friends at Genentech for making this possible. Just a little about our organization. Ovarian Cancer Research Fund Alliance is the largest global organization dedicated to fighting ovarian cancer. We advance research to prevent, treat, and defeat ovarian cancer. We support women and their families before, during, and beyond diagnosis, and we work with all levels of government to ensure ovarian cancer is a priority. That last part is Chad's job. Now, before we get started, I have just a few housekeeping notes to go through. So all listeners, you will be in a listen-only mode throughout the presentation. We should have some time for questions after the presentation. So if you think of a question as you're listening, you can type it into the Q&A box that you can see on the right-hand side of your screen. I'll see the questions, and I will select some to ask Chad at the end of the presentation. And there's no need to wait until the presentation is over. You can just type them in as we go along and as you think of them. So I'm very pleased to have my colleague, Chad Ramsey, here as our speaker tonight. Chad is Vice President of Policy here at OCRFA, and he works with policymakers on Capitol Hill and our organizational allies to implement the policy agenda for ovarian cancer and to achieve our organizational priorities. He also serves as staff liaison to the Congressional Ovarian Cancer Caucus and monitors efforts within federal agencies, including the CDC, FDA, NIH, and CMS as they relate to the OCRFA's policy agenda. Prior to joining OCRFA in 2015, Chad was Director of Legislative Relations for the National Marrow Donor Program, where he worked to ensure that patients in need of bone marrow donor were able to find a suitable match. He also served as Director of Federal Legislation for the Brady Campaign to prevent gun violence and has more than 18 years of experience in public policy and advocacy in the nonprofit sector. Chad graduated with honors from Hobart College and earned his master's degree from the Maxwell School of Citizenship and Public Affairs at Syracuse University. So Chad, I will pass the mic to you, and you can start your presentation.
Great. I think we need to figure out a way to limit that introduction, make it a little shorter.
Well, you know, you're our only speaker, Chad, so you get all the time.
Can you see what I've got up there now, Sarah?
Yes, I can. Looks good.
Very good. Okay, thank you very much for that introduction, and thanks everyone for joining us. It looks like we have a good group of attendees, and so we'll go through my presentation, and we'll try to leave plenty of time for questions at the end and get through as many as we can in this hour. So again, thanks for taking the time on this evening, and let's get started. First off, I want to thank our one of our newest staff members, our Associate Director of Policy, Vanessa Kramer, for her work on this slide deck. If you think it's fantastic, it's because I gave her great direction. If you don't like it, it's because she just started. So let's start there. So here's what we're going to do today. Why should you be an advocate? We're going to go over why it's so important that you're doing what you're doing and you're on calls like this, but also in meetings with your members of Congress and doing what you can do there. We're going to talk about your role and understanding the power that you can have as a constituent and an advocate. I'm going to go over a bit of the congressional landscape to see where we stand in Congress in both House and Senate. We'll also look at what the administration is doing, what they're up to these days. There's a lot going on. And then we'll give a policy overview, a little explanation of the budget and appropriation process and where we stand on that. And I'll also talk about where we stand with the Affordable Care Act repeal and how the reconciliation process plays a role in that. So why should you be an advocate? now is a really interesting and somewhat unsettling time. We're seeing tens of thousands of advocates and protesters readily here in Washington, D.C. and across the country. So constituent voices are really mattering now more than ever, particularly as we look at the Affordable Care Act and the timing of its potential repeal and replacement with a new administration. It's incredibly vital to have informed voices working together to try to improve the conditions of different policies that we're focusing on. We really want to try to improve the organization's leverage and our reach. I can go up on the Hill and talk to members of Congress. Vanessa can do the same thing. And it's terrific and it's an important role, but when you happen to talk to someone at the supermarket or in your hometown who works for a member of Congress, it has a lot more impact, and your roles as survivors, as caregivers, as advocates gives you a lot more credence than ours does as Washington, D.C. folks. The relationships that you can build can foster really important communication and also provide us with information that you'll get that we won't be able to hear. If you have a relationship with someone, and that sometimes simply is following up with an email after a meeting, you can form those relationships that really help inform the constituent, but also inform the member of Congress into what we're really looking for and what you're looking for as votes come to the floor. And really talking about raising the disease profile of ovarian cancer, making sure that people understand that this is an important disease that needs to be addressed. You know, unfortunately, it's an incredibly deadly cancer. It's an incredibly expensive cancer to treat, so we need as many allies as possible to remind members of Congress how important this is. So, yeah, understanding your role and knowing your power. I think you've probably seen a lot of the coverage that has been coming out over the past month or so, particularly when it comes to the Affordable Care Act. Members of Congress who are in safe Republican districts are being overwhelmed at town halls with concerns that the Affordable Care Act is going to be repealed, that they're going to lose their health coverage, that they're not going to be able to pay their premiums, or they're going to see the insurance plans disappear completely. This is resonating on Capitol Hill in a way that is unexpected to a lot of observers. Most of these members of Congress have been running on repealing OBAMACARE and the Affordable Care Act for the past 4 to 6 years, and now that they are in power completely and able to do just that, they're really having to take a pause. And that pause is for a number of reasons, but a big one is because there's been a lot of squeaky wheels out there, and those squeaky wheels are getting louder and louder and louder. And really, members of Congress have been put on notice that any sort of actions that they take on the Affordable Care Act can't be as cavalier as they were when President Obama was there with the veto pen ready to go. So maintaining a continuous drumbeat is really what we're looking for. So we're going to have an advocacy day here in March on the 1st, and what we're really hoping is to get a lot of people on the same message, to remind members of Congress how important our advocates, to remind them how important our research funding is and how important proper coverage, essential health benefits are for Affordable Care Act, a number of important messages that we'll have in March. And then we want to follow that up with calls and letters and emails and social media posts, you know, attending town hall meetings immediately afterwards. It's that sort of continuous drumbeat that really helps our issue resonate. So what are we seeing right now with Congress? If you're watching CNN and MSNBC and Fox News every day like I do, you're getting inundated with this. But what we're really seeing is an effort to get President Trump's cabinet appointments confirmed through the Senate, and that process has been taking longer than he'd like. Currently, the Democrats are looking to hold the floor overnight to delay a vote on potential Education Secretary Betsy DeVos. There's going to be a real battle over Supreme Court nominee Judge Gorsuch, so that's coming up. Certainly, the repeal and replace effort on the Affordable Care Act is taking up a lot of steam on the Hill, and we'll get into that a little bit more. And then the appropriations process. Congress never passed 2017 appropriations bills for 11 of the 12 bills. The only bill that they did pass was the Military Construction and Veteran Affairs bill. So there are still 11 appropriations bills to fund the government for 2017 outstanding. There's a continuing resolution that was agreed upon in December, which keeps the lights on until the end of April. But the hope is that there'll be some activity on appropriations now. And FY 2018 budget appropriations are ongoing already, and we're already seeing some members of Congress that have put up deadlines for budget requests at their office. So that process is going to march forward. Speaker Ryan has said, as he said before, and as other Republicans have said, that they're looking for a return to regular order. And I'll get into what regular order means a little bit more down the line, but basically trying to stop this process of governing by continuing resolution. And we're likely to see efforts to rein in spending, which will include entitlement reform, and we're also likely to see changes to the tax structure. So here's what the Senate looks like now. We've got 52 Republicans, we've got 46 Dems and 2 independents who both caucus with the Democrats. So it's really a 52-48 split. And that makes things very tight. And so you see like a situation with Betsy DeVos, when you have 2 Republicans that peel off to join the Democrats, you're at the 50-50 standing, and Mike Pence would come in and break any ties were that the case. So we may very well see that tomorrow, which would be a sort of a historic occasion. Leadership has changed a little bit. There's no more Harry Reid on the Democratic side. We have Chuck Schumer, who's been a good advocate for research funding, and Dick Durbin from Illinois. And on the majority side, Senator Mitch McConnell of Kentucky, who you see a lot, and John Cornyn is the whip. So what this means is that Republicans lack the 60-vote margin that they would need to invoke cloture on any particular vote in the Senate. And it's been a few years since that's really been a threshold to meet. And so most up or down votes in the Senate require that 60-vote threshold now. And so it's going to be a real effort to try to bring in some of those Democrats, particularly Democrats who are in Trump states like Montana and Missouri and Michigan. As you see, the 2018 Senate map does not look good for Democrats. They have to defend 25 of their seats, and Republicans only have to defend 8. So that's likely to mean that as we get closer to the midterm elections in 2018, there's going to be a real effort to try to get some of those red state Democrats to equivocate on some issues. So it's going to be very interesting in the Senate. In the House, it's not really that much different than it has been over the past few years. Democrats still with Republicans still with a healthy margin of 47 seats. Speaker Ryan is still calling the shots technically for the Republicans, although he's he's met with some real opposition, particularly amongst his own party. As we note here, the House Freedom Caucus, which really came into some power in 2015, represents a real conservative wing of the Republican Party who have felt, I think, in some ways emboldened after the most recent elections and the victory of President Trump. And it's given them, you know, a little bit more power. And so there's going to be a real sort of battle on that side. And it's sort of what we're seeing so far when we look at the Affordable Care Act. You consider the retreat that was just held in Philadelphia last week or the week before, I can't even remember now, to try to get on the same page when it comes to strategies for the Affordable Care Act. A lot of that, the differences and agreements come with between this Freedom Caucus and the more, excuse me, establishment Republicans that Paul Ryan really represents. So let's see, where are we? Sorry about that. Now that the Republicans control all three branches of government, they really have the responsibility that power brings. You know, you look even back at 2015, there were several votes to repeal the Affordable Care Act. There was a reconciliation vote of 2015 that did a lot of things that effectively repealed the Affordable Care Act, but they're all vetoed by President Obama. And so that now that President Obama is no longer there to cool the hot tea of this House and Senate, I think that we're seeing a little bit more trepidation as they move forward. That said, there's a real effort to deliver on some of these campaign promises and to bring about entitlement reform, tax reform, and repeal the Affordable Care Act. So we're likely to see some things. Already, President Trump has been aggressive with his executive orders. Obviously, we've already seen that there are some testing of limits, particularly when it comes to immigration reform. We're likely to see more of that moving forward. Some other, gimmicks that we've talked about, including the reconciliation process, the Congressional Review Act. The reconciliation process is something that we'll talk about a little bit more coming up, but this is something that sort of came out of the Budget Act of 1974, and it allows the Senate to do some things that aren't subject to that 60-vote threshold. And so we'll talk about that a little bit more in a bit. We've already seen some changes to committee rules to move forward on some nominees like Congressman Price and Betsy DeVos. When the Democrats tried to deny a quorum, Republicans changed the rules and moved those nominees directly to the floor. So we're likely to see some more shenanigans on both sides as the nomination party process continues. And the nuclear option. President Trump sort of trotted that out recently, and it's certainly going to be a topic of discussion when it comes to the Supreme Court nominee. It's unlikely at this point that he would be able to win that 60 votes necessary to invoke cloture and go to an up or down vote on his nomination. So it'll be interesting to see what Mitch McConnell and his allies decide to do and whether that nuclear option is invoked. I think in general, Senator McConnell is not one to enter into that lightly as a real establishment Republican who's been in for a long time. But we'll see what happens when push comes to shove. So, right, we talked a little bit about what the administration is up to. He's really trying to get his nominees into place. And so Representative Tom Price is one that we're really focused on. He would be Secretary of Health and Human Services, longtime member of Congress, He's also an orthopedic doctor. He has been an outspoken critic of the Affordable Care Act and certain elements of it in particular. So that's going to be a really interesting hearing, but vote, which we're likely to see this as early as this week. A few other shenanigans listed here about boycotting the confirmation hearing, but we're likely to see some more action from President Trump on executive orders. I think what we're also seeing is some people in Congress bristling at the way President Trump has been going about some of his executive orders, and there has been a lot of confusion that's been sowed. And so, you know, it'll be interesting to see how both branches of government start working together more effectively. It almost seems like a lot of members of Congress are taking cues from tweets, and so it's going to be interesting to see again how they start to react to that. There really has been no consensus. We don't know about the timing of any sort of effort to repeal or replace. In fact, President Trump just said in an interview, I think yesterday, that maybe it wouldn't happen until end of this year, maybe next year. So it's a continuing moving target. Now we just want to do a little overview of policy and then get into some of the specifics. Here are the committees of jurisdiction that we focus on here at OCRFA. Not going to spend too much time on this, but you can see which committees deal with which aspects of the government, and so there are quite a few issues that we deal with. We'll be working a lot with the appropriations committees early on as the appropriations process really starts to gear up. So as we've talked about the budget process, we're likely to see a budget come from the White House at some point, but it hasn't made its way out yet. We hear that they're really making some deep cuts in their proposed budget. Now that budget is just a blueprint, as any type of budget is, and it'll just be used by members of Congress to help guide them as they move forward. The appropriations process in earnest works with 12 individual appropriations bills. And as I mentioned last year, only one of those bills was actually passed. And so the hope is to return more towards regular order so you can get those actual appropriations bills passed, and so that we can look and see what each area is spending on and where changes can be made. So the Congressional Budget Resolution, which has already been agreed to, outlines for 2017, outlines the overall spending and the budget caps for each subcommittee of appropriations, and it makes certain assumptions moving forward. And it's really the sort of top-line blueprint for numbers. And the Senate has spending targets. They're called 302B allocations for each, and so that's really, when you hear about top-line numbers, that's what they're talking about, and that comes from this Congressional Budget Resolution. And so technically, each subcommittee has the ability to determine what that money should go to underneath those spending caps. So here's how it should work. Here's what regular order is. I referred to it a little bit earlier. We would see the President's budget come out now-ish, and then the Congressional Budget Resolution would be marked up and passed. And then in March, the appropriations subcommittees would really get to work on drafting each of their bills, getting it marked up, having hearings, responding to programmatic requests like ours. We have programmatic requests every spring. I'll get into those a little bit later. And then in May, June, and hopefully before the fall, each of those appropriations bills gets marked up and passed. Now, Vanessa wrote sometimes here, and she knows that unfortunately most times moving forward, it hasn't happened, and we've been really operating under continuing resolutions for years now, and it's been a very long time since all 12 appropriations bills actually made it through and were passed, and that's problematic, and that's part of the reason why people are frustrated with Washington, D.C., I think. So the House and Senate Appropriations Committees, we focus on two of them, and there are really focusing on the Labor H subcommittee and the Defense, the DoD subcommittee. These subcommittees are really responsible for putting forth the pieces of legislation that would fund the programs that we're interested in. So where are we now? FY27 appropriations are meant to fund the government through September 30th of 2017. As you can see, we're several months into that, and we have several bills. We have only one appropriations bill that's been funded. And so what we're in now is a continuing resolution, CR. And that, I think I have on here March, but it actually goes to the end of April of 2017. So once we get to that date, technically the government will run out of money. And so it's been used over the past years as really a bludgeon or a reason why Congress needs to act. They say we're going to run out of money by this time, and so you have to pass this legislation or we're going to let the whole government shut down. That's been a continuing tactic, and it's been extremely frustrating for people who work in Washington, D.C. It's likely that Congress will continue to fund the government using CRs, or what's probably most likely is a DoD appropriations bill will get passed, and then there may be an omnibus appropriations bill. And by omnibus, I mean just a whole bunch of bills rolled into one. And so what we're thinking is most likely is that the 2017 Department of Defense bill gets passed sometime in the next couple of months, and then an omnibus bill gets considered. In the meantime, we're also starting the FY 2018 budget process. We are starting to meet with appropriations committees, making our requests, putting in our programmatic requests, and that process is ongoing. We'll see how far we get. So here's just a look of the appropriations committees. As I mentioned, we focus on the DoD committee and the Labor H committee of appropriations, but you can see there's the 12 subcommittees. Each subcommittee has their own appropriations bill. And here's the membership of the Senate DoD Appropriations Subcommittee. Take a look there and see if there's anybody in your home state. If there are, we're going to have to send you after them. Same thing on the Labor H side. These committees have jurisdiction over the National Institute of Health, the CDC, agencies like that. Here's the House side of the DoD. Done some changes. And the House Labor H. There's our friend Rosa DeLauro, who's the ranking member on the Democratic side. She's also the chair of our Congressional Ovarian Cancer Caucus, and will continue to be a leader for us as long as she's lurking the halls. So I thought it would make sense to talk a little bit about the reconciliation process. You've probably been hearing a lot about it, and as I mentioned before, something that came out of the 1974 Congressional Budget Act. There are things that the Senate can use this for and things that they can't use it for. The reason it's been talked about a lot is because it's an expedited process that only permits 20 hours of debate and by cutting off that debate, you no longer have a 60-vote threshold. And so Senate can only use it for a certain category of things. things that are scored by the Congressional Budget Office, things that have to do with government spending or taxation. You can't specify precisely how committees will meet their budgetary goals through this process, but it's an interesting. I think I've got my headings slide up. So this is a little. There's some things that are a little off, but basically what we need to keep in mind as we go forward with the budget reconciliation process is that it allows for some things to be repealed, but it doesn't allow for things to be replaced. And so we have this great slide here that sort of gives us an idea of what could possibly be done through reconciliation. On the left side, you see things that could be used to eliminate spending. So we're talking insurance subsidies, those monies that are set aside to allow people to help pay for their premiums. I think they paid up to 400% of the welfare line. There were some monies available to people, so that was important for some people. You could limit the fund for Medicaid expansion, and you could change taxation processes through the reconciliation process. It can't be used for certain things, provisions requiring insurance companies to provide certain benefits. So we're talking about essential health benefits there. It can't be used to remove people from pre-existing conditions from gaining coverage. So that's there are limits to what the reconciliation can do, but it is a powerful tool. One of the things that we haven't talked about, but that could be done once Tom Price is in as Labor HHS, or excuse me, as HHS Secretary, there are things that he can do, the administration can do, potentially that President Trump can do. For instance, ending the mandate on contraceptive coverage. This is something that he has been very vocal about, and once he becomes the Secretary, there's a very good chance that he could do that unilaterally almost. Could also allow changes in benefits that give insurers more latitude to craft these cheaper plans. So you can't do it through reconciliation, but the Secretary does have that latitude. So he could, for instance, say, well, insurance companies don't have to require, or excuse me, don't have to cover all of these essential health benefits. They can make a decision and then allow consumers to decide whether or not that plan is good enough for them. That would allow health insurance companies to offer cheaper plans, but they would not be as comprehensive, and they might be leaving some of the plan holders in the lurch if they get sick. Secretary Price could also enact stricter monitoring of Affordable Care Act enrollees, and that would be a way to ease the concerns that that insurance providers have. The issue really is here that there aren't enough young, healthy people buying insurance to supplement the cost of the older, sicker people, and so that's what they're trying to get at as they move forward. So where are we with reconciliation? Here's where we are. Both chambers of Congress passed the budget reconciliation with instructions directing the committees to submit legislative action to repeal Affordable Care Act. So that's where we stand right now. We're unsure exactly when that's going to happen, but what we're hearing is that it's going to be early March. And so that could be really line up well with our visit to Capitol Hill on March 1st. So here's a great slide that Vanessa found that sort of goes through the process of repealing and replacing Obamacare. And as you can see, we are around step 3 right now. The Senate has already passed a budget resolution to repeal the Affordable Care Act, and the House has passed the budget resolution, and now they're looking at, House and Senate are committees are looking at ways to draft legislation and figure out exactly how they can move forward on this. There are a number of additional steps, but I think step three is probably the one that's going to take the most time as we move forward on this. It's likely that that we'll be dealing with this throughout the entire year, possibly further, until there's some sort of piece of legislation that's brought. This will also likely be done piecemeal, and so it's little things. And from what I've seen with the president, he likes to take bold strokes, and I think he may do something like that, but it's unlikely that he would take some action like repealing the individual mandate provision. And by that I mean he technically probably could tomorrow pass an executive order and have Tom Price enact an order that would say you're no longer required to purchase health insurance, which is known as the individual mandate. That could be done. That would almost immediately trigger health insurance companies to pull out of the exchanges. Those insurance companies technically would have 6 months in order to pull out, but it's also possible that by doing that, there would be some federal contracts that would be voided, which might allow companies to pull out even quicker. So that is sort of, we talk about the nuclear option, that's sort of the nuclear option on the Affordable Care Act. I think at this point it's unlikely that that will happen or some other drastic changes, but nevertheless it's something that we need to continue to focus on and be aware of. So here are some other concerns that we have with regard to Affordable Care Act, particularly from Ovarian Cancer Research Fund perspective. The Prevention Fund, this was part of the Affordable Care Act, and it's meant to provide additional funds for cancer screenings and other things, awareness funds, through the CDC. Now this program has become a little bit larger than it was initially thought of, and it now represents about 12% of the CDC budget. This is important to us because the CDC runs a few programs particularly focused on ovarian cancer. The Ovarian Cancer Control Initiative and Johanna's Law are both through the CDC. If the Prevention Fund were slashed or eliminated, as some are talking, that means the CDC's budget is going to be slashed by 12%, and it's likely that programs such as ours could be cannibalized. So we need to be very careful about the Prevention Fund. Something that we're also concerned about is the narrowing of networks. And by that I mean when hospitals choose not to participate in some of the health insurance plans. And we're seeing this particularly with some of the top cancer centers. They're no longer accepting patients through certain health insurance plans, and this is a real concern for us and you. And this is something that we really need to address, particularly since standard of care is such an important element in treatment prognosis for ovarian cancer. Something that we're also very interested in is ensuring that lifetime caps are not significantly raised, that caps on out-of-pocket costs per year don't go up. We know that cancer and ovarian cancer is very expensive to treat, and we also are working on ensuring that pre-existing conditions are continue to be allowed to get health insurance. We've signed on to several letters and let members of Congress know that that provision of the Affordable Care Act should be maintained. So just basically, that's a little overview of what we want to do on the Affordable Care Act. you know, we're looking at maintaining coverage for as many of ovarian cancer patients as possible. We're really trying to make sure that networks don't narrow too much to exclude plans, making sure that pre-existing conditions are still permitted, and looking at that prevention fund so that we don't see cannibalized programs through the CDC. Now, with research funding, with the appropriations bills, we're going to continue to push that as well. Now, I mentioned the DoD bill, and you may wonder why we're talking about that. The Department of Defense contains within it the congressionally directed medical research programs, and amongst them is the Ovarian Cancer Research Program. And it is, excuse me, the only dedicated federal source of funds towards research in the United States. Annually, they fund $20 million worth of research, and they do a good job of it, and it's sort of the more high-risk, high-reward research. And so, unfortunately, since the Department of Defense Appropriations Bill for 2017 hasn't passed, they're unable to release their funds. They have $20 million worth of research that they can't release until that bill is passed. Even if there's a continuing resolution, that money is still held up. So it's very important for us to move that DoD bill forward, and so that's going to be a high priority for us as we continue this appropriations process. Likewise, the Labor H bill contains research for the National Institute of Health and the National Cancer Institute, which is part of the NIH. They also put a big chunk of money towards ovarian cancer research annually, and we need to make sure that that program continues. We also want to ensure that monies from the Cancer Moonshot, which were allocated at the end of last year, are used for the purposes outlined in the Cancer Moonshot. That is to say, speeding up cancer cures, increasing sharing of data and personalized medicine, and is not used to augment current funding levels. And so we don't want to see monies that would have gone towards ovarian cancer research go now towards simply towards the goals of the Cancer Moonshot. So that's important to us. Here's a quick rundown of our appropriations asks as we move forward. $20 million for the CDC, or excuse me, for the DoD OCRP, the CDMRP down here. This is DoD, CDMRP, they mean the same thing to us, and that's $20 million. We're also going to ask for continued funding for the NCI and NIH. We don't have an exact number for that yet, but we will by March 1st, and $8 million for the Ovarian Cancer Control Initiative and $5.5 million for Johanna's Law, which is the CDC. Those asks will be maintained, and again, those are the ones that we're concerned about due to the potential loss of the prevention fund. Lastly, I just wanted to have up this slide which shows that the funding has been fairly level over the past several years. Unfortunately, the purchasing power of that funding has dropped quite a bit over the past few years. So we've got our work cut out for us. I think with that, I'll just put a stop and open it up to any questions if anybody's still with me.
Yes, people are still with us. So thank you very much, Chad. Really appreciate it. So much good information. I always learn something anytime I hear Chad talk. So we have a few minutes, just a few minutes for Q&A. If you haven't submitted your question, just type it into the Q&A box. And just before I forget, this presentation, the audio and the slides, it's all being recorded and it will be up on the OCRFA website later this week. So there's been a lot of good information here. So if you want to go back and listen again, see the slides, you'll be able to do that. All right, so question. You mentioned at the start of the presentation, Chad, the Ovarian Cancer Caucus, and there was a question about that. Who are the members? Could you just talk a little bit more about what that group is?
Yeah, this was this was a caucus that was formed at the end of 2015, and the chairs are Congresswoman Rosa DeLauro and Congressman Sean Duffy, and it's a bipartisan House coalition, caucus, excuse me, and we're up to about 30, I think it was 37 members last I looked, and we need to grow that caucus this year. That's going to be one of the things that we work to do. And along those lines, I'm trying to get a website up for the caucus so that we can make it easier for people to see what they're all about and see who's part of that caucus. So stay tuned.
Okay, great, thank you. In the slides that you flashed by that showed the members of the appropriations committees, why are there fewer Democrats on these appropriations committees? Is that just because there are fewer Democrats in Congress right now?
Yeah, basically, that's the way they're apportioned, and Senate Republicans, since they're in, or excuse me, Senate and House Republicans, since they're in the majority, are permitted to determine the makeup of those committees, and so it's really based on control of the House and Senate in general. So you'll see that the House committees generally have quite a few more Republicans, whereas the Senate committees just have are a little bit closer to parity.
Got it, okay. There's a question that came in early in your presentation when you were to talk about the importance of people going to the Hill. Question said, read the Affordable Care Act. Is there a value in telling our own personal stories in dealing with ovarian cancer and how critical insurance is to treatment and staying alive?
Absolutely. That is the most important thing that you can do. For better or for worse, members of Congress often govern by anecdote, and you often will hear people in their impassioned speeches on the well of the Senate referencing individual constituents, talking about how important it is to them. Those individual stories can do a number of things, can bolster their argument, but it can also turn someone who maybe was a supporter into a champion. When they hear those stories and they start to connect, it really makes a difference. We've seen what the power that, one member of Congress or two members of Congress can have when they're really passionate about something. And so those stories, to my mind, make the issue much more personal and important to members of Congress, and we need to have those connections as often as possible.
Great. How do we influence committee members if none of them are in our state?
That's right. It's difficult. They are much more responsive to constituents. So hopefully you have friends and loved ones who are in those districts and states. You can get on Facebook and Twitter and Instagram and I don't know, Snapchat. You probably have people in your network who are associated with those. And I also don't want to minimize the impact that you can have by encouraging your own member of Congress to do more, to really engage. It's possible that they have a friendship with someone. We see these all the time in Congress. People like to work with someone on the other side of the aisle, or they have a partner that they see in the gym. And so, if you can really engage your own member of Congress, that can be helpful. But also reaching out to people in your network. You never know who lives somewhere or who knows somebody. And so the more you can be vocal and active about it, the better off we'll be.
Got it. Great. Okay, let's see. Someone is saying the planned budget slashings are very concerning, possibly creating a competitive situation between varying cancer groups that are vying for funding. Is there initiative to work together? So, Chad, maybe you could talk a little bit about some of the coalition work that you do.
Yeah, absolutely. And it's great, and we do vie for resources. And that's always difficult, but we work very closely together. For instance, there's a coalition called One Voice Against Cancer, and it's comprised of about 30 cancer organizations working on a number of different types of cancer, and we all get together and determine what the ask should be when it comes to NIH, the National Institute of Health, particularly what funding levels should be for the National Cancer Institute. We work very closely together on that. Likewise, we work in a coalition called the National Defense Research Consortium, and I was in a meeting just last week with, it must have been 25 groups, where we all work together to talk about how we can best make our case to continue funding important research at the Department of Defense. These types of coalitions are very important, and I think the Ovarian Cancer Research Fund Alliance is part of about 7 or 8 national coalitions. And so this is something that we do a lot of. I find it to be very useful, time-consuming but useful, and it helps us really work together. I'm often on the Hill in meetings with 4 or 5 other groups, and we think that really helps bolster our voice and shows them that we're working together.
Mm-hmm. Thank you. All right, maybe just 2 or 3 more questions. Here's a question. How do we find out how the cancer moonshot funds will actually be allocated? Who currently has oversight of these funds? And is there any direct benefit to OCRFA from the Moonshot Initiative? Not yet on that last part, I can say.
Yeah, that's a great question. It's the NIH who has the resources from the Cancer Moonshot. And the last we heard, they had not yet been transferred over to the NCI. And so I don't think much has been done yet at all on that. But the money is technically there, and it's spread out over the next 6 years. As to how we keep tabs on what's going on there, it's going to be something that the NIH is going to report out quite frequently on their progress. And the acting director of the NCI, Dr. Lowy, has promised to all of us that he's going to stick around for as long as he can. And I think that if that's the case, as long as he's in there, we stand a really good chance of getting some progress and hearing about it as well. But you're right. This is something that we can't let go. And I'm also hopeful that Vice President Biden will continue to stay focused on this issue. I think he will. I think he thinks it's part of his legacy. And his advocacy, I think, will be an important factor.
Okay. Here's an interesting question. How do we best use the fact that oral contraceptive use of 5 years significantly drops a woman's risk of ovarian cancer? So birth control pills are used for ovarian cancer prevention. What's the best way to tell that story, or how do we leverage that important fact for the benefit of patients?
No, it's a great question. That was one of the things we formed a question very similar to that to try to get it asked at Congressman Price's confirmation hearing, but we weren't able to get it landed. We worked closely with other organizations to try to make sure that this gets out there. We were very supportive of the Affordable Care Act's requirement of making sure that contraceptive coverage was there. It's something that we're talking to all of our Labor H appropriations people. It is something that that particular bullet point is important, and it's really one of the only preventative things that we've found in the ovarian cancer space. We work with friends over at Planned Parenthood as well on the different court cases that have come forward to make sure that point gets the airtime it deserves. But really, I think it's just continuing to make sure members of Congress hear that. I think it's an important scientific point that we can make, and it's an important way for us to get involved in that particular debate. So I'm going to continue to think about ways in which we could really rally behind that issue, and then you know, we'll make sure that folks who are on our e-activist or our email list hear from us on that.
Okay, Chad, last question, sort of general one here. For those who can't make it to the Hill for our Advocacy Day on March 1st, what can we do in the meantime? And sort of as a part two, if advocates are reaching out to their senators by phone and their voicemails are full, what do you normally suggest as an alternate to that?
It's a great question. You know, what you can do, and it's difficult if they are full, right? So you're going to laugh, but writing a letter on paper and sending it in is really impactful, and it's even more impactful than a phone call. You know, as someone who's worked on the Hill, you often are doing the tally, right? You're looking to see how many people called on this issue, how many people called on the other side of this issue. But when you get a handwritten letter, it counts as a little bit more. And so that's one potential way of doing things. There's usually a way for you to leave constituent feedback on the website. I don't like that way of going about doing it, because I feel like those get undercounted. But that is, you know, if there is a full mailbox, that is something you can do. But one really important thing to do is find their Twitter handles and other elements of feedback that you can have on social media. That some members of Congress, some presidents, some current U.S. presidents are very responsive to being called out publicly on social media, and that is something that I've found is becoming an increasingly important thing. So tweet at these members of Congress, use a hashtag that makes sense, and we're going to try to be better about organizing social media so that we can make this easier for you to do in the meantime. We'll certainly have a social media strategy crafted around before and after our Hill Day, our Advocacy Day on March 1st. So stay tuned on that. We'll provide some background and details. But in the meantime, yeah, track down your members of Congress Twitter handles, start following them, and when there's an opportunity to weigh in, please do so.
Okay. Well, it's 7 o'clock. I want to thank Chad very much for his presentation, and I want to thank everybody who called in tonight for your time and for listening. So please take a minute to fill out the survey that will appear on your screen at the conclusion of the webinar. Your feedback is always very helpful to us as we put together future topics for webinars. And for more information about OCRFA, you can always visit our website at www.ocrfa.org. And thank you all so much, and have a wonderful evening.
Thank you.